Cardiovascular vascular disorders. The development of an arterial embolism is a potentially life-threatening event. The embolus will usually form in the heart and can be a clot or it might be plaque that has broken loose. If the thrombi comes from the right side of the heart, it's going to go to the lungs, causing a pulmonary embolus. If the thrombi comes from the left side of the heart, it usually will go to the legs. Symptoms, well, they may have no pain or they can have severe pain, along with symptoms of tissue ischemia. Symptoms of ischemia in the lower extremities will include severe acute pain that's aggravated by movement or pressure, a gradual loss of sensory and motor function in the affected areas, absent distal pulses, pallor and mottling, and a sharp line of color in temperature demarcation. In other words, you can actually see where the changes are. Treatment, we'll treat this with intravenous anticoagulants and thrombolytics. We can do a thrombectomy where we actually remove the clot. If we fail to restore that perfusion, it will result in tissue death and amputation. So with nursing care, we need to be certain that we immobilize the affected limb except for 15 minutes of range of motion exercise and protect that limb from injury. With peripheral artery disease, this is characterized by pathologic changes in the arteries, especially plaque formation that can occlude blood flow causing hypoxia. Peripheral nerves and muscles are more susceptible to harm from hypoxia than the skin and subcutaneous tissues. Severe oxygen deprivation can lead to ischemia and then to necrosis. If PAD has a gradual onset, the patient might develop some collateral circulation, so they may not show the symptoms of ischemia or hypoxia. This disease is more common in men over 50 years of age. And other factors are the presence of atherosclerosis, embolism, thrombosis, trauma, vasospasm, inflammation, autoimmune responses, hyperlipidemia, diabetes, hypertension, smoking, and stress. Symptoms will include an intermittent claudication, which is the classic sign of peripheral artery disease. And this includes aching, cramping, tiredness, and weakness in the legs that occur with walking, and they're relieved by rest. There's an absence of pulses, pain during rest, tingling or numbness in the toes, cold and pale skin that reddens when the leg is in a dependent position, muscle atrophy with subcutaneous tissue loss, thickened toenails, shiny or scaly skin, hairlessness, and that's a big one, arterial ulcers with a pale wound bed. And if one extremity is affected more than the other, size differences between the extremities can be very apparent visually. We diagnose this through duplex imaging, segmental blood pressures, and angiography. We treat it by encouraging lifestyle changes such as smoking cessation, exercise, and weight management, the treatment of comorbid diseases, drug therapy for claudication by preventing platelets from clumping and by dilating blood vessels and antiplatelet therapy. Surgical interventions can include an endarterectomy, which will remove the obstruction, grafting, which replaces the diseased vessel, and catheter-based interventional radiology procedures that can actually enlarge the interior diameter of the vessel. Nursing care, we need to be certain that we're monitoring pulses that are distal to the surgical site. Cessation of a pulse will suggest possible arterial occlusion, and the surgeon has to be notified immediately. Thromboangiitis obliterans is also called Berger disease. This is an inflammatory thrombotic disorder of the arteries and veins in the lower and upper extremities. The cause is unknown, but it does occur only in smokers. Symptoms will include intermittent claudication, rest, rest pain, so in other words, they have pain at rest, skin color or temperature changes in the affected areas, cold sensitivity, abnormal sensation, ulceration, and gangrene. This disease is mostly found in India, Korea, and Japan, or people who have immigrated from those countries. Diagnosis includes arteriography. The most important thing about treating this disease is smoking cessation, and then we provide palliative treatments that include sympathectomy, spinal cord stimulation, analgesics, antibiotics, and prostaglandins are sometimes used. Now realize that 40% of the patients that continue to smoke, despite being encouraged not to, will require amputation, and amputation if gangrene develops. Raynaud's disease are forms of intermittent constrictions of the arterioles that affect the hands but can also affect the toes and the tip of the nose. We also see increased sensations of cold, pain, and skin color that goes from a pallor to a cyanosis and then to redness. Finger involvement is not symmetric and the thumb is usually not affected. Gangrene has been known to develop with this disease. The cause of this primary Raynaud is unknown, but it may be related to hypersensitivity, to cold, or a release of serotonins. The cause of secondary Raynauds may be related to connective tissue or a collagen vascular disorder. This disease is more common in women 16 to 40 years of age. This disease is mostly seen during the winter months or in the northern areas and is aggravated by stress. We diagnose it based on the signs and the symptoms and the absence of evidence of occlusive vascular disease. The goal of treatment is to prevent pain and promote vasodilation in the extremities. We can offer some drug therapy such as calcium channel blockers or alpha adrenergic blockers. We can do transdermal nitroglycerin, endothelin receptor antagonists, and phosphodiesterase inhibitors, along with IV prostaglandins. We can also do a sympathectomy, biofeedback, smoking cessation, avoidance of alcohol and caffeine, along with other vasoconstricting drugs. An aneurysm is a dilated segment of an artery that's caused by weakness and stretching of the arterial wall. Conditions that are associated with aneurysms include Marfan syndrome and Ehlers-Danlos syndrome. Acquired aneurysms can be caused by arteriosclerosis, trauma, infection, hypertension, high cholesterol, and infections. The most common site is going to be the abdominal aorta. Symptoms will depend on the location of the aneurysm. If it's thoracic, there might not be any symptoms at all, up to and including a deep diffuse chest pain. There may be angina, hoarseness, edema of the head and arms, back pain, epigastric pain, and constipation, again depending on the location of the aneurysm. Complications would include a rupture, a thrombus formation, emboli, and pressure on surrounding structures. We diagnose this with imaging procedures. Treatment repair is usually done as soon as possible, but it can be delayed until the patient has been evaluated for other problems that will increase their surgical risk. An aortic dissection is a small tear in the intima that permits blood to escape into the space between the intima and the media. This blood will accumulate between the layers, causing the media to split lengthwise. Now that split can extend up and down the aorta, where it can start to occlude major arteries. Risks of complication is higher if the dissection is in the ascending rather than the descending aorta. If there are no complications, the patient can be managed with antihypertensives and other drugs to decrease the strength of the cardiac contractions. Otherwise, this affected area is replaced with a synthetic graft. A key aspect of postoperative care is we have to keep the blood pressure at the lowest possible level. Varicose veins are referred to as varicosities that are dilated, tortuous, superficial veins in the lower extremities. The valves in these veins are incompetent and they do not prevent the backflow of blood. Varicosities can occur in other areas such as the esophagus and in hemorrhoidal veins. Incompetent valves in these blood veins cannot be replaced or repaired. Varicose veins are classified as primary, where only the superficial veins are affected, and secondary, when they're characterized by deep vein obstruction. These can be caused by a hereditary weakness exacerbated by aging, pregnancy, obesity, and occupations that require standing for long periods of time. Symptoms that you can see would be the onset of varicose vein disease being really gradual, but this condition is definitely progressive. If the varicosities are superficial, there are minimal signs and symptoms except for the cosmetic changes. The veins can be oversized, discolored, and tortuous. They may have dull, aching sensations when standing or walking, may experience muscle cramps, a feeling of heaviness in the legs, muscular fatigue, ankle edema. And when the patient has had this condition for an extended period of time, they can develop a post-phlebitic syndrome that consists of persistent edema, brown skin discoloration, and ulcers. We diagnose varicose veins through their appearance and ultrasonography to help evaluate the extent of obstructions. Conservative treatments of varicosities are used whenever possible, and these patients need to avoid restrictive clothing, prolonged standing or sitting, crossing of their legs, and weight reduction, support stockings, sclerotherapy, light therapy or laser therapy, and surgery, which would be a ligation and stripping or an endovenous ablation. Venous thrombosis. Phlebitis is an inflammation of the superficial vein. Now, if a thrombus forms in the presence of phlebitis, then it's called a venous thrombosis. These can be superficial or they can be deep. Superficial thrombi are generally in the saphenous veins, while deep thrombi are generally in the femoral, popliteal, and the small calf veins. If there are superficial and deep vein thrombi, it is referred to as venous thromboembolism. Complications include pulmonary embolism. Risk factors: patients that are on bed rest, surgery in patients that are over 40 years of age, leg trauma that requires casts or traction, previous venous insufficiency, obesity, oral contraceptives, and malignancy. Virchow's triad are risk factors that lead to venous thrombus formation. This includes blood stasis, vessel wall damage, and hypercoagulability. These veins are going to feel firm and cord-like. They can be warm, red, and tender, and pain with edema occur with a deep thrombus along with a low-grade temperature. We diagnose these with venography, a Doppler or duplex ultrasonography, lung scan, pulmonary angiogram, and CT scan. The goal of treatment is to prevent the thrombus extension and pulmonary emboli. Anticoagulation or thrombolytic therapy, bed rest, elevation of the extremity, warm, moist soaks, Compression stockings and surgery are also treatments that can be used. Chronic venous insufficiency is the culmination of long-standing pressure that stretches the veins and damages the valves. This will increase venous pressure and ultimately cause edema. RBCs actually seep into the tissues, and a brown staining of the skin called hemosiderin staining or stasis dermatitis occurs, and this is a permanent staining. It does not go away. Ulcers can form because of the pressure that's been exerted by edema or as a result of trauma. These venous ulcers frequently will form on the medial malleolus. They're usually chronic, and they're susceptible to infection and ultimately may require amputation. Symptoms will include edema, the stasis or venous ulcerations, heaviness or dull ache, cool skin, cyanosis when the legs are in a dependent position. We diagnose them by physical appearance and non-invasive screening. Compression is used to help promote venous return. These patients should avoid standing still, should avoid crossing their legs, should avoid restrictive clothing. We need to encourage them to do calf pumps when they're sitting, and this will help promote venous return, in addition to keeping their skin well hydrated. And lymphangitis is an acute inflammation of the lymphatic channels as a result of an infectious process, which is usually streptococcus. Symptoms will be enlarged lymph nodes along the lymph channel, tenderness, a red streak from the infected wound along the lymphatic path, as the nodes will drain into the lymphatic system and the cardiovascular system. We may see elevated temperature, chills, and these patients can form abscesses with purulent exudate. We diagnose it through culture and lymphangiography, and we treat it with antimicrobials, incision and drainage of abscesses, wet, warm dressings, and if these occur in the legs, support hose, and analgesics.